So when we talk about atrial fibrillation, the most interesting point that is a strong association with stroke risk. In fact, atrial fibrillation increases the risk of ischemic stroke fivefold. Sometimes some authors said more than fivefold. This makes atrial fibrillation not just a arrhythmia problem, but a serious cardiovascular issue. Cerebrovascular. No, cardiovascular and cerebrovascular issue, of course. So the reason is that when the atrial fibrillate, they do not contract effectively. Instead, blood fibrillates, vibrates in atria, becomes stagnant, especially in the left atrial appendage. This stasis promotes clot formation, and if a thrombus embolizes, it can travel to the brain, causing the ischemic stroke. Interesting that about 1/3 of all ischemic stroke are attributed to atrial fibrillation, and the risk increases with age, hypertension, diabetes, heart failure, and prior stroke. No, ischemic, of course, not hemorrhagic one. That's why anticoagulation therapy using agents like warfarin or direct oral anticoagulants is one of the most important interventions, my beloveds, in atrial fibrillation management, often more important than rate control itself. So if you remember, we have rhythm control and rate control. Rate control doesn't matter what's happening, we have to put in sinus, back in sinus. And rate control doesn't matter what type of atrial fibrillation we've got. The most important is heart rate below 80 to prevent heart failure signs. So anyway, both schools are for anticoagulation therapy, that is direct oral anticoagulants, like warfarin or direct oral anticoagulants. Understanding that this link between arrhythmia and stroke prevention is crucial for both clinical practice, my beloveds, and patient safety. So you will be asked about that on your big board exams, and so the most interesting point that atrial fibrillation is not just about the heart, it's a major stroke prevention challenge, and recognizing this can save lives. Okay, get it? Good, stay blessed.